I'm going to show you the exact protocol that I use when working on infants to do craniosacral therapy. So this is a model of an adult cranium, and this is my baby. And what we're trying to do is provide very gentle motion to the cranial bones, releasing tension around the cranial sutures in order to relieve any craniosacral tension that is in the infant's skull. This tension can be as a result of birth trauma, or maybe the baby's sleeping habit. If they're always sleeping turned to one side, you might start to notice some changes in the baby's head shape. If there's any difficulty with nursing, latch, gas, and colic, then a craniosacral release on the infant's body can be incredibly helpful. There is the nasal bone, the frontal bone, the parietal bones, temporal bones, ethmoid here. Sometimes we'll do some release on the jaw, the occiput. These are the bones that I'm going to be mostly working. A lot of times when I'm working with an infant, it is best if the infant is suckling. So having a pacifier or a finger in the mouth, or even while the infant is nursing or feeding at the bottle, can be really helpful. So when the infant is actually has a good strong suck and is feeding properly, it is the easiest to do the cranial work. So I'll often tell parents to show up for their follow-up appointments with baby a little hungry, so that way we can get straight to nursing and I can begin the cranial protocol. Otherwise, sometimes the infants are perfectly happy and we can just begin. And when I'm working with your newborn or any infant, the pressure is very, very light. So if you wear contacts, you know the amount of pressure that you use to put the contact in and out of your eye, it's very minimal. That's the amount of pressure that I'm using when I'm working with an infant. Okay, so we're going to do a nasal bone release. Okay, I'm going to do a sphenoid release right here behind the eyes. Frontal bone lift. Okay, parietal lift. A lot of times I'll do some gentle ear pulling towards the shoulders direction, like I was making little elf ears. The occipital lift is sort of behind the head, gentle little pressure. Obviously, I went very fast. With an infant, I might take a little bit more time. And if the baby is, suckling or nursing, then you might see me working one side, switch to the other breast, and then I'll work the other side, or bilaterally while the infant is nursing.